So the healthcare providers that are here tonight, you guys work the front line. You're down in the trenches treating patients. So we want to put on a show for you. We want you to come and not only learn the latest and greatest treatments in cancer care, but we also want to entertain you. You deserve it. And we also want to inspire you so that you consider joining our cause to improve cancer care in Louisiana and to make Louisiana the model state for cancer care in the country. Wouldn't that be something? So that's why we have the amazing conference goodie bags. We end tomorrow's first day of the conference with a brass band, a second line to honor everyone who's passed away of cancer and currently fighting cancer. If you participate in the second line, you get a drink ticket, and everyone have a cocktail before their dinner. So we're really, really excited about this weekend, and thank you for being a part of it. I'd like to introduce tonight our first keynote speaker, U.S. Senator Bill Cassidy. Senator Cassidy, who's also Dr. Cassidy, he's a champion in D.C. for amazing healthcare legislation, a lot of bipartisan healthcare legislation, because cancer is one of the few issues out there that's actually bipartisan. So we're super happy to have him here tonight, and I'm just going to turn it over to him so that he can say a few words.
Thank you, Chad. I am giving a keynote address when people are lined up at a bar. It's like only in New Orleans this is when you would do it, you know? I thank y'all for your mission. I'm a gastroenterologist, hepatologist. My practice when I did it was we saw a fair amount of liver cancer. We all are touched by cancer. I would like to think we all have the opportunity to defeat cancer. My own role, I'm the lead Republican on the Health, Education, Labor, and Pension. My committee has oversight of the NIH. My committee has oversight of ARPA. My committee has oversight of CDC. And when they come to me, I'm saying, what are you doing for the states that have a high disease burden that aren't in California, Massachusetts, or a state like that? Some of this is bearing fruit. I'm sure you know that in Louisiana, we are going after a National Cancer Institute designation. And when they came to speak to us, they said, we want you to specifically look at the rural-urban divide. Why is there not, well, of course we know there's not, that we can't help but notice that there's not the same screening, the same prevention, the same treatment opportunities in the rural areas relative to the urban. We can address that. We can also already point to successes. Our enrollment in the NCORE is better than other states. The network that's been developed will be the backbone of what we do with NCI. So when Monica Bertinoli comes, my committee has oversight of what she's doing. You can be sure our conversation centers on what she's doing to make sure that those in rural areas have the same opportunity as those who are in urban areas. The woman who heads the ARPA yesterday came. My conversation again is how do we make sure this is not concentrated in 1, 2, or 3 cities in the United States, but rather it is spread so that all Americans can appreciate this. I could keep going, but there's a bar and y'all are in front of it. I just want to say I thank y'all for being frontline. You are all my colleagues. If there's some way that I or my office can help support you as you help combat cancer in our state and elsewhere, I am committed to doing that. We are united in purpose, united in cause. Thank you very much.